I see the red light live button. Welcome to our Monday afternoon Employee Wellness Livestream. I'm delighted to have Dr. Seneca Carrillo with us here today as our guest. And before we get into some great conversation here, do want to let everyone know that this is not personal medical advice. If you are seeking personal medical consultation with Dr. Ovidia and his team, please reach out at team@ifixhearts.com. But again, this live stream session is for education, empowerment, and enjoyment purposes only. So there's our medical disclaimer. And Seneca, wonderful to see you virtually.
Thank you for having me. No, this is going to be fun.
Great. So I'm sure there's some of our listeners who already know you, but for those listeners who do not, can you tell us a little bit about what you're doing, how you ended up in this metabolic health space, and just paint us a good picture here today?
Sure. So I'm an emergency medicine physician. I'm board certified in emergency medicine. I've been doing that for about 25 years. And in the last 5 years, burnout rates are pretty high in the emergency medicine sector. And I was really looking for something that was a little bit more fulfilling. And I had some personal family members that were kind of having some medical issues, specifically my spouse. And I had to drag him to the PCP and get some testing done. And she was fairly astute and handed us a little bit of homework, which was to read Dr. Fong's book, The Obesity Code. And it kind of just springboarded me down this path of looking into metabolism and insulin specifically. And gradually I have now inundated myself with so much information that I felt like I needed to share and evangelize, as we often do in this community, where once you learn stuff and once your eyes are open to things that you really didn't feel like you had a good grasp on, you want to share it with everybody. And so I decided I would open my own practice, specifically helping patients improve their metabolic health. So I own my own clinical practice. I call it like a boutique practice. I only see like 5 to 10 clients at a time, but I work with them really closely one-on-one. And it's mainly related to disorders of insulin resistance. So whether it's diabetes, hypertension, obesity, PCOS, migraines, hyperlipidemia, the whole host of things that are connected to insulin, we target, but we do it through lifestyle. And I'm just a little different from some of the average, a dietitian or a nutritionist or life coach, in that I can manage medication. So this is such a powerful intervention that having a provider physician that can dial back medications as people start to improve their health is really important. And I don't think in this sort of milieu of medicine today, PCPs and primary care docs, they don't have the time, and they don't actually often have the education to even know how to pull back meds, to deprescribe. And that's something I've had to learn on my own too, because that was not what I was taught in medicine throughout my education. So now I have this sort of offshoot that helps fulfill my life. I still work in the emergency department. It keeps me kind of like finger on the pulse. But I also take every opportunity I can with my patients in the ED to talk about nutrition and stress. And it's a little bit about more luxury, because it isn't 10 minutes of booked office time. It's like, well, I know I got to move fast, but I got 20 minutes. I can sit here and we can have a conversation. And my colleagues might not like it because it slows things down, but I sure get a lot more out of it by doing that.
Oh, absolutely. So a lot to unpack there. Where to begin? So first I want to just jump right into something you mentioned at the very start, which is really a burning issue, not only amongst doctors like yourself, but in the employee, in the company corporate setting, and that is burnout.
Yeah.
You talked about, obviously an emergency surgeon like yourself, or emergency doctor, you're dealing with all kinds of stress there.
Mm-hmm.
How would you address, even broad strokes or small practices within the workplace for individuals also dealing with that, whether those are executives or the employees?
So this is something I'm still trying to figure out and learn. And I listen to all the podcasts about all the burnout I possibly can. But some of the tips that I've taken away, and it sounds like a luxury, and it is a luxury, but it's actually to work less. And I think in our culture, especially in America, like we are very work oriented, and our lives revolve a lot around how productive we are. And if you look across the world, a lot of other cultures, they're not quite as connected to that work pressure. And so dialing back the number of hours that I've worked, even if it meant taking a financial hit, has been huge for burnout. And I think allowing myself not to feel guilty about that is also sort of key. But, stress in general, I mean, that's burnout is related to stress. There's lots of different things, especially even with my personal patients, that we'll talk about on how to manage. So that's making time for exercise, and it's making time for meditation and social connections, and maybe doing some yoga, breathing techniques. And those are all, they feel very crunchy, but they're really important tools. And I'm not going to downplay it, but sometimes, therapy is really key, right? So if you're really struggling, sometimes having a therapist that can help you with your mindset, just sort of how you look at your day-to-day job, can be very helpful, even if it's just for a short period of time, just to give you some of those tools to help reframe what your day-to-day looks like, and how you can kind of change some of that potential negative burnout mindset into something more positive. Those are things I'm always working on.
Oh, those are great tips. And you mentioned the word mindset there. We will just put up that we have several white papers we've written that are free, available for download here. And one is specifically on mindset, and mentioned just a couple of those tips that you about, not feeling guilty about taking time for yourself, and taking those couple minutes to do maybe some breathing or some stretching in that way. So very practical. Great tips. I see we've already got one question coming in here. Maybe you want to tackle this. I was told by my cardiomyopathy was
Takotsubo.
Takotsubo process type 2. That pronunciation always escapes me. It was nearly a year since it happened. I've been carnivore for about 16 months now. Would my heart be healthy now? Well, again, reminded this is not personal medical information, but
sure.
Thoughts on that, Seneca?
Yeah, so Takotsubo is so interesting because it's often related to stress. We call it broken heart syndrome. It often can happen after you lose a loved one, and that stress, emotional stress, causes vasospasm and affects your heart muscle. But it can happen for other stressors too. So, but yeah, it can damage the heart muscle, and the heart muscle is like any muscle. It needs, to repair. And the beauty about the heart is that it does actually thrive on ketones. And when you're on a carnivore diet, you tend to be much more prone to be in ketosis. Not everybody, it's hard. Like ketosis is a difficult sort of state to get into. And it depends if that's even your goal. But having additional ketones is actually really great fuel for the heart, for remodeling, and for healthy heart repair. I mean, the only way you're going to know is actually to get some good follow-up with a cardiologist, where they can ultrasound your heart and see how things are functioning and pumping. But the beauty about Takotsubo is that it is not necessarily a structural abnormality. It's more of a response, typically, although I am not a heart specialist. I will defer to Dr. Ovadia for a lot of that.
Right. And we'll say, if you have sort of personal questions, you'd like to talk specifically to heart surgery, you can always reach out to us at team@ifixhearts.com about personal health issues. But it's great how that tied right into the old stress picture that we were just talking about. And I want to reach back to something that is very unique. And I love that you mentioned that about deprescribing medications. And from our perspective in the corporate wellness arena, we want to work with employers to also make that an option. And this is unusual. All right.
Yeah.
The normal, let's say, plan of action is prescribe more. So
Mhm.
talk to us a little bit, give some of our listeners a little bit of insight of, just maybe some examples of how that works, or,
Sure.
what kind of benefits you're seeing in your patient population.
Well, and so this is where the luxury of having such close one-on-one contact with my patients is kind of the unique feature, because there's real-time adjustments that often need to be made. I often, especially with my clients, I'm texting them every other day, and they have direct access to me, so I could often check in with their symptoms. So if they're starting to feel dizzy, or they're starting to get lightheaded, or their energy's sort of dropping, we can check in on blood pressure readings. I've had to dial back blood pressure meds pretty quickly when someone starts to do things that we do to improve our metabolic health. And there's lots of tools we use. But so blood pressure medicines often will be some of the first things to fall off. Specifically with diabetes, if you're on insulin and you start making some of these changes in your diet, that is extremely dangerous. And knowing how to reduce insulin and to reduce some of the other diabetic medications, the oral medications that are kind of stepwise, is super important, because you can drop those blood sugar readings pretty quickly once you make these changes. They're so powerful. I've had patients, I have a patient who's gotten off all of her insulin over a period of about 4 months, which is crazy, because that just doesn't usually happen in normal medical practice. I have another gentleman who's over 400 pounds. He's lost 60 pounds doing alternate day fasting, but we've had to half his insulin fairly steadily. He's still on insulin, and sadly, he's probably going to always need insulin because his pancreas has just burnt out from his diabetes. But we've now got him on like a third of what he used to be on. And so his endocrinologist they can hardly get in to see an endocrinologist. So I'm able to sort of see in real time his glucose readings. I can see when it's fluctuating. I can see when he's getting more lows. We check in. I talk to him about what his dose is, and we bring it down if he's having more low glucose readings. That's the sort of tricky, scary part. And knowing kind of which ones of those diabetic oral medications you want to remove fast, and which ones you can kind of leave on that aren't going to be as scary. But that's a whole separate education in and of itself.
Absolutely. And you mentioned coming off your blood pressure medicine within the coaching sector. That's sort of a number one topic that we talk about, how quickly individuals, once they adapt good practices with a low carbohydrate, low sugar, whole foods diet, that is usually one of the first medications that they can let go of. And it goes with any medication. You want to work with your doctor and do it in a smart manner. But this is exciting. One thing we see within our practice too is that many people are wanting to let go of medications. I think there's been, whether you attribute this to the resurgence in the MAHA, the Make America Healthy Again, but even just over the past, I'm going to say 5 years, you see more and more people interested in not following that multiple medication route. Do you see that in your practice?
Yes. When we first meet with clients, my first question is, what are your goals? And almost all of my patients want to reduce their medication levels. Like, they want to be on fewer meds. And some of it's just because of the insurance milieu we're in, right? It's expensive to have to keep paying for medications every month. People are often on fixed incomes, and if they're having to pick between medications, that's really frustrating. Or they're using a lot of their fixed income for the medications and not being able to do other fun things. And it's just a burden to take multiple medications all of the time, and then have to worry about the side effects, and then see all the different doctors that are prescribing the different versions of those medicines, whether it's primary for one and the heart doctor for another. So many cooks in the kitchen. So the fewer that your ingredients in the recipe, right, the better off, I think, people do, as far as complications with meds too.
Absolutely. And speaking of patients, what would you say are some of the biggest barriers you confront within your patients of really adapting, whether it's a low carb or carnivore or ketogenic lifestyle? Is it the time they don't cook, or they're afraid because there are other doctors saying, oh, this is not healthy. What are some of the barriers you encounter?
So all of those things. One of the things I think that's so helpful is a partner that's supportive. I've actually, I have read on my website, I'm like, couples get a discount because when you're doing it together, it's so much easier. And there's, you get support for each other. So that can be a barrier if you don't have a supportive partner or someone who's going to continue to eat or indulge a certain way. And it's very hard to not be tempted by that. That's a huge barrier. But I think, the cooking is part of it. I mean, we live in such a modern society of convenience. It's much easier to not have to get all the ingredients and spend the time to cook. So I do spend quite a bit of time with patients with simple apps for recipes that I know don't taste terrible. So I use the Diet Doctor app, even though it's a subscription-based app. I use it all the time for the free recipes because they're almost all low carb, high protein. And you can kind of adjust the carb component. And they're easy. They're not super complicated, but it feels like you're getting a really delicious meal. So there's that. And then there's those people that they don't have the time. We talk about meal prep so that if you have one day a week where you can do a large batch of something that you can then freeze and then heat throughout the week. If you don't have time, we do that. Or if they're eating out a lot. I have a client that was a stockbroker, Morgan Stanley, was going out to fancy dinners all the time with his clients. And so we would figure out the menu items that are the most, the best options for him. So, I mean, you can get steak and veg at a lot of these fancy restaurants. So, but that would be over, the pasta dishes or the higher carb dishes. So learning how to order at a restaurant, learning how to order off the menu so that it's still beneficial, even if you don't have the time to cook. And I do, a couple of my clients have time restrictions because of kids. And I will tell you, this is the hardest part is, kids are so picky. We don't always want to put our foot down sometimes with kids. Sometimes the kids don't eat all their food. So parents end up eating their leftovers. So we have conversations about, how the parents improving their health and their health choices are going to just trickle down to the kids. And eventually they're going to get these healthy habits too. So it's an investment in the kids when they're cooking at home and they're eating better. They're not just ordering the chicken nugs for the kids and the spaghetti, but they're all having steak and broccoli.
I love that trickle down effect. I had a client recently who I've been working with, and she shared with me that she was so excited that her daughter actually had struggled for quite some time with her weight, pretty much most of her life. And since her mom was working with me, she lost 25 pounds, the daughter. And this trickle down effect is huge.
It's like just an osmosis.
Right. And this is also, we see this in our employer program. So someone, starts working and we have to say, you can't make other people change, but you can show them that it's working. And,
the proof is in the pudding. Yeah.
Yeah, absolutely. I see Amanda, who had put the original question up. She had a little follow-up. My cardiomyopathy was caused by my status. There we go. Can you see that?
Yeah.
There. When my body was overusing energy and had something to do with oxygen.
Sure. Yeah. So she's talking about status epilepticus, which is like a seizure issue where you have back-to-back seizures and you're in a seizure pattern for a prolonged period of time. And that can affect oxygen flow to your brain, but also to your heart, to your tissues. And that can be a stressful enough event that it can cause something like Takotsubo.
And again, this is not personal medical advice. And from the seizure perspective, we know the origins of the ketogenic diet was in the early 1900s, was treating epilepsy. So always an interesting path to go down. There's a wonderful documentary called Charlie's Story about the film director whose son had epilepsy, and the only treatment that ended up working was a ketogenic diet after they tried all kinds of medications. A little side adventure there. But I want to ask you a question about, do you see different challenges or successes in your male versus female population? And I put that out there because we get a lot of questions about, well, I would never eat that amount of protein because that's more for guys.
Yeah.
But just any variations or tips you can offer in either avenue.
No, I think you're right. I think especially because for the last 30, 40 years, it's all been about low fat, and women are used to eating a lot of salads, and the volume of food that they are used to eating is smaller, and they think that if they're going to eat more of it, that that's going to make them fat. And that is a difference. I think men are a little bit less preoccupied with the volume of food. I think they've always kind of been encouraged to eat more. It's just about the what it is, like the actual choice that you're eating and how much volume that is. So that's a challenge, getting women to actually eat a little bit more of the good stuff, right? So I have a client who, she's like, I had chicken breast that was stuffed with asparagus the other day, and I cut it in half. I'm like, why are you cutting it in half? Eat the whole breast. Because then she was up at 2:30 in the morning and she was hungry. And I'm like, hunger is the enemy. Like, you want to be eating enough at each sitting so that you're not waking up in the middle of the night pilfering the cupboards for bad things. So that's, I think, a challenge. I think the other big thing for women, especially the ones that are coming to see me, but I think in general, is as we approach perimenopause and menopause, there's all this stuff that's changing in our bodies that is really frustrating. We have no explanation for it outside of hormones. And sometimes until you get dialed in the hormone issue, it can make it really hard, even doing all the right things to get where you need to go. So I would recommend women also be looking at their hormones when they're worried about their metabolism, because as menopause hits, insulin resistance just skyrockets. That's why we get the menobelly, and that's why fat just sort of sticks around the belly and it's harder to move. So that's its own barrier for women. And then I think for men, I think stress management is a lot harder. One, because I think in general, men aren't maybe as accustomed to seeking out ways for stress management. I mean, the yoga classes are often filled with 90% women, but that's part of how women are trying to manage stress and breathing techniques, or using meditation apps. I feel like I struggle with my male clients to get them to sort of open their minds to how to manage their stress better. Like, it's very like internalized, like I can deal with this. This is not a cerebral problem, even though it's affecting them internally as their bodies are rebelling with cortisol that's potentially spiking and high and causing fat deposition in places that's unusual or not normal. So addressing the stress for men, I think, is a challenge.
Those are great points, and really highlight a couple things of importance. The dogma around fat, or the decades of you should be afraid of fat. Our philosophy is eating fat doesn't make you fat, particularly if it's a good kind. But overcoming that can be really challenging, as it can be for some people just even increasing their protein quantity. Right. For good muscle maintenance. And I'm not even talking muscle building, muscle maintenance. Yeah. And that stress piece that you mentioned. Do you, you've mentioned you work with some apps, you suggest things. What are some other tools? Because I have to mention that word, because your website, which we'll put up here, Toolkit MD, I love the name. Are there any sort of secret sauces or secret tools you'd like to share with our audience today?
Yeah, no, I've got lots. That's why I picked this name, because there isn't one size fits all. And I know you guys talk about it too, but what works for one person is not necessarily going to work for another person. So having a nice armamentarium of different things you can offer, ways to eat, foods to eat, hacks. So I talk a lot about with my clients intermittent fasting, but that is not just a blanket itself, right? So there's variations of that. I like calling it time restricted feeding because it doesn't sound as intimidating, right? But that can be, 6-hour window, 4-hour window, 8-hour window where you're feeding, and then the rest of the day you're fasting. Then there's the 5-2 fasting, right? So you're 5 days a week, you eat like you normally would at whatever time you want. And then 2 days a week, you're eating virtually no calories or 500 calories or less. And so you're getting these spaced out sort of fasted days. And then alternate day fasting, which is a bit of a bear, but I have a client that is using that and he loves that tool. He'd done carnivore, he'd done keto. He tried just the regular intermittent fasting of 8-hour eating window. None of that was moving the needle for him. But as soon as he started, he would do lunch. He would fast until lunch the next day, and then he'd have lunch and dinner, and then he'd fast and from the lunch the next day. So it was lunch to lunch. He was doing alternate day fasting, and he didn't find it that onerous. He was still eating every day. It was just that every other day it was just one meal. And when you look at it that way, it doesn't feel like, oh my God, I'm starving myself for an entire day where I can't eat anything. And that's how he has dropped 60 pounds in about 4 months.
I love it. Right.
Yeah.
Yeah. I've been using this term metabolic sparks because just as you say, there's no one size fits this at all. One fits one. And sometimes it's just changing it up, finding a different way of approaching it that might just be that spark to get your, metabolic markers moving.
Mm-hmm.
And
agree. Yeah. I also talk with clients about hacks, right? So we talk about food order. So if you're really like, I got to have the rice, or it's part of my culture, or I've got to have the tortilla, we talk about putting that at the end of the meal, because the glycemic load that you'll get if you eat it after your veg, your protein, your fat is going to be much less of a burden and spike insulin less. We talk about vinegar. Vinegar is a great hack to have before something that has carbohydrates in it. These are not passes. These aren't ways to allow yourself to eat cake, but social events happen and you don't want to necessarily derail yourself. But if you are going to celebration and you might have a piece of cake, having something with a pickled vegetable beforehand, or having something like apple cider vinegar and water beforehand, that's a little bit of a hack. And then sometimes supplements can kind of help with maximizing sleep and making sure that if your sleep is corrected, then you're not so hungry the next day. And so really dialing in all the pillars where we talk about nutrition, stress, sleep, exercise, the big one is a really hard one for people to get to. We talk about that almost at the end of our approach, because it's sort of the hardest one, I think, for people to incorporate if they're not already doing it. Right? Is if they've never been an exerciser, to try and start pulling that in. Sometimes it's just little bands. Sometimes it's just getting walking. Sometimes it's getting body squats in. And sometimes it's actually getting to the gym with a trainer and doing full resistance training, because that's how you're going to really improve insulin.
Absolutely. And we had a wonderful physical therapist, Jason Hahn, as a guest on. He was a head trainer, but also a physical therapist for the Los Angeles football club, LAFC, for football, I say, as a European, soccer to most Americans. Right. And he said, just tomorrow, start doing more of what you did today.
Yeah.
And you're already ahead of the game. And it is that just finding a movement that you'll get started with and then see where that leads you. Mm-hmm. There's another word you had on your website. I know we're getting close to our time. It's called repairable. Is metabolic health repairable?
Oh, yeah. No, 100%. It surprises me all the time. And this is why I'm feeling so much more fulfilled doing this clinic that I have than I do, sadly, in the emergency department. I'm there in the ER for the people's worst day. And I appreciate that there's a value there. But seeing people come off of medication, I just never seen that in 25 years of doing this. That's so bizarre. I know it can be done. I've seen people's numbers reversed. And when we get labs, sometimes we'll do the 3-month sort of follow-up after we've made some of these changes. And I'm like, wow, I did not even expect someone's fatty liver to be reversed, their hemoglobin A1C to drop so much, their blood pressure readings to improve so well, their waistline to shrink. Like, these are all things. I'm not doing it. People are doing it, but they're doing it with these lifestyle changes that are so much more powerful, I think, than we give them credit for sure.
Oh, well, what a fabulous, we're like seconds away from the top of the hour. And just to remind our audience, if you want to reach out to Dr. Carrillo, her website is Toolkit MD, right there. If you're looking for heart surgeon to be in the practice of Dr. Ovadia and our team, you can reach out at ifixhearts.com/talk. And if your company is not promoting metabolic health and you would like it to, start spreading the word. metabolic health is repairable. You just heard it from Seneca. And we're all about that with our metabolic health programs in the workplace. You can reach out to us also there. This has been an absolute delight.
Yes, thank you. This has been fun. I want to talk about this all day. I could go forever.
Well, once you go down this rabbit hole, or as we say, once you've seen it, you can't unsee it.
100%. Yeah.
And our community is growing. I mean, I love the way, for those of you who don't know, Seneca and I are both in Arizona. The Arizona low carbohydrate metabolic health community is growing.
Yeah.
And this has been fabulous. Really appreciate your incredible insights as an ER doctor and now as a metabolic health expert. Keep doing what you're doing.
Well, thank you. You too. Keep spreading the word.
We will. All right. And thank you all who joined in live. And for those of you who are going to be listening to the recording, keep listening.